thoroughly about the enteral route of drug administration. In today's class, we will be looking at the parenteral route of drug administration and in detail regarding about the various injection routes. Parenteral route. Routes of drug administration other than enteral or intestinal route are known as parenteral routes. Here, the drugs are delivered into the tissue fluids or blood. The various parenteral routes include injections, inhalation, transdermal route, and transmucosal route. What are the advantages of parenteral route? The action is more rapid and predictable. That means it is very fast, and you can also predict how much amount of time it will take for the drug to act. These routes can be used in unconscious and uncooperative patients, and irritation to the gastrointestinal tract can be avoided, whereas in enteral route we saw that the medications can cause the irritation to the gastrointestinal tract. It can be used in patients with vomiting or those who are unable to swallow. And also in emergencies, parenteral routes are very useful because the action of the drugs are rapid, and it could also save the life of the person in case of emergencies. What are the disadvantages of parenteral route? Because it is an invasive route, that means it is going into the skin or even into the veins or arteries. Asepsis must be maintained. That means we have to follow very strict aseptic techniques. Then the injections may be painful. Why? Because a puncture is going to be made through the layers of the skin. It is also more expensive compared to the tablet forms. It is less safe because there are more chances of infection also through this route. That is why we say asepsis must be maintained. And it is inconvenient. Why it is inconvenient? Because again, the person has to come to the hospital to get this route of drug administration, as well as it is painful to the person. Injury to the nerves and other tissues may occur. Therefore, we have to be very careful that we follow the right methods of the injecting of the medications. What are the various forms of injections? Intradermal, subcutaneous, intramuscular, intravenous, intraperitoneal, intrathecal, intraarticular, and intraarterial. Let's see one by one. Intradermal. The drug is injected into the layers of the skin, raising a bleb. Here you can see what raising a bleb means in the image shown below. That is, in the first layer of the skin, you're going to inject the medicine at a 15-degree angle, and a small bulge is going to occur on the skin. What are the examples of this type of injections are BCG vaccine and even some tests for allergy. For example, before administering a penicillin drug or when you're testing for tuberculosis, this type of intradermal injection is given. What are the disadvantages? Only small amount of drug can be administered by this route, and it may be painful. Subcutaneous. Here the drug is deposited in the subcutaneous tissue. The examples are insulin and heparin. Here, the angle of the drug administration is 45-degree angle. What are the advantages? As this tissue is less vascular, absorption is slow and largely uniform, making the drug long acting. So, when you are giving an insulin injection, why you are giving it through the subcutaneous route? Because the absorption is slow and the drug will act for a longer amount of time. Whereas if it is short acting, what happens? Again and again they will have to take the drug. Second, it is reliable and patients can be trained for self administration. So the person can be trained for self administration where he can take this injections form at home by himself. What are the disadvantages of subcutaneous route? As subcutaneous tissues are richly supplied by nerves, irritant drugs cannot be injected because they can cause the severe pain. So we should be very careful that we inject the medicine correctly and do not cause any nerve injuries. In case of shock, absorption is not dependable because of vasoconstriction. So you do not know if the absorption is happening fast or slow or how it is happening due to vasoconstrictions in the tissues. Repeated injections at the same site can cause lipotrophy resulting in erratic absorption. Here what is happening? There could be the damage to the layer of the skin because of the repeated punctures at that site, and the absorption might not take place correctly. Therefore, we have to alternate the sites of the injection while giving through the subcutaneous routes. What are the other methods of subcutaneous administration? One is dermojet. In this method, a high velocity jet of drug solution is projected from a fine orifice using a gun. So here what is happening? There is no needle here. So because of the high velocity, the drug is directly injected into the skin and it goes into the subcutaneous tissue from where it is being absorbed. The other method is pellet implantation. Small pellets packed with drugs are implanted subcutaneously. This again it will be like a small cut which is made into the subcutaneous tissue, and these pellets are implanted and the skin has to be stitched again, and the drug will remain over there and slowly get absorbed. The example is testosterone. Next, we see the sialistic implants. The drug is packed in sialistic tubes and implanted subcutaneously. So, here the examples are hormones and contraceptives. What happens over here is you have to remove this sialistic tube again. The drug is packed in the sialistic tube, but once after implanting it, the sialistic tube has to be removed and the drug will remain in its place and slowly it will get absorbed into the body. Intramuscular. Aqueous solution of the drug is injected into one of the large skeletal muscles, for example, deltoid, triceps, gluteus, or rectus femoris. The angle of the injection should be 90-degree angle. Absorption into the plasma occurs by simple diffusion, whereas larger molecules enter through the lymphatic system. As the muscles are vascular, absorption is rapid and quite uniform in nature. What are the advantages of intramuscular injection? It is reliable. Next, absorption is rapid and the soluble substances, mild irritants, Depot preparations, suspensions, and colloids can be injected by this route. As you know, that some of the injections are oily in nature, okay, or it could be made up of substances. So these injections can be given in the intramuscular route. Why? Because it will get absorbed and there might be some amount of pain, but these cannot be given in the intravenous route. So the best method is the intramuscular route of the injection. The disadvantages of intramuscular injection, it may be painful and even result in abscess. So what is an abscess? An abscess is a swelling around the area of the skin. Therefore, in the nursing responsibility, when you are giving an intramuscular injection after administering, you have to rub that area to ensure that the drug is spread into the muscles. Otherwise, there could be the swelling and even the redness can happen, and finally it could also lead to the pus formation in that area. So we have to be careful with the intramuscular injection to prevent the abscess. Irritant solutions can damage the nerve if injected near a nerve. Therefore, we have to make sure that we follow the right methods of injecting the drug. Next, intravenous. Here, the drug is injected into one of the superficial veins so that it directly reaches the circulation and is immediately available for action. So, here, through directly the injection can be injected into the veins, or we can even use a tube through which these injections can be administered. The drugs can be given as IV, bolus, slow injection, and slow infusion. So, in bolus, what happens is here a large dose is given, for example, heparin, and the drug is dissolved in a suitable amount of the vehicle and injected slowly. Okay, so when you're giving, say for example, an infusion that is given in a bolus form. Next, slow injection. Here, over 15 to 20 minutes, it will take for the injection to go into the system. Example is aminophyllin. Next is slow infusion when constant plasma concentrations are required. For example, oxytocin to induce the labor. These large volumes will be given as a slow infusion where it might take 3 to 4 hours for say 100 ml of oxytocin to enter into the drug. So we can monitor how fast or how slow we want to inject the drug. The advantages of intravenous injection is it is the most useful route in emergencies because the drug is immediately acting on the person's body, and it provides the predictable blood concentration levels. We can predict within half an hour this drug is going to act on the person, or within 10 minutes, within 15 minutes it will cause the action. Large volumes of solutions can be given. Okay, so if you are giving a saline solution, maybe 500 ml or even 1 liter can be administered depending on the condition of the person. Irritants can be given by this route as they get quickly diluted in the blood. For example, some antibiotics which could be as an irritant can also be given in this route, and it will get diluted and it will cause the right action in the person. Rapid dose adjustments are possible. For example, any unwanted effects occur, like the person feels itching sensation all over the body, which is one of the adverse effects. Infusion can be stopped immediately and therefore prevent the further problems to the patient. The disadvantages of intravenous injection is once it is injected, the drug cannot be withdrawn. So we have to make sure we inject the right amount of drug. Any extra dose given could be harmful for the patient. Irritation of the veins may cause the thrombophlebitis. What do you mean by thrombophlebitis? It is the inflammation of the veins. Extravasation of some drugs may cause severe irritation and slowing. What do you mean by extravasation? That means if you're not injecting the drug properly into the veins, then the fluid will get collected in the outer layers of the skin and it will form a bulge. And as it remains over there, it can cause the irritation of the skin and even the peeling of the skin can occur. We have to be very careful that the injection is injected correctly into the veins. How will we check this? When we withdraw the syringe, we will see that blood is coming. Therefore, we know that it is in the right place. Only aqueous solutions can be given. Okay, what do you mean by aqueous solutions? That is easily dissolvable in the blood. So on, only which are soluble in the blood type of solutions should be given. That's why we said if it is fat soluble, those solutions should not be given in intravenous route. It should be given only in the intramuscular route. The self administration is very difficult for this method. Next, moving on to intraperitoneal. The peritoneum offers a large surface area for absorption. This route is used in case of peritoneal dialysis. Next, intrathecal. Drugs can be injected into the subarachnoid space for action on the central nervous system. The example are spinal anesthetics. Strict aseptic precautions are a must. Drugs also can be given extradurally. Morphine can be given epidural to produce analgesia, that is, to prevent the pain. And direct intraventricular administration of drugs may be employed in case of brain tumors. Intra-articular drugs are injected directly into a joint for the treatment of arthritis and other diseases of the joints. Example, hydrocortisone is injected into the affected joint in case of rheumatoid arthritis. The strict aseptic precautions are required. Intra-arterial, here the drugs are injected directly into the arteries. It is used only in the treatment of peripheral vascular diseases, local malignancies, and diagnostic studies like angiograms. We should also follow the rights of medication administration, such as right patient, right medication, right dose, right route, right time, right documentation, right reason, and right response. The important questions which can be asked from this topic are: mention the types of injections, discuss the advantages and disadvantages of intravenous injection, subcutaneous injection for 5 marks, intramuscular injection for 5 marks, dermojet for 2 marks, and intrathecal injection for 2 marks. Please subscribe, like, share, and comment how the video was. We will surely improve. Thank you.